Welcome to the What Does Science Say channel. Today, we're talking about something that affects so many of us, breast cancer. But we're not going to focus on the fear. Instead, we're going to break down the science to show you how knowledge really is power. So here's our roadmap for today. We'll start with the genetic stuff. You know, the hand you're dealt. Then we'll get into the exciting part, the lifestyle choices that you can control. And we'll wrap up by looking at what treatment looks like today and what the future might hold. You've probably heard this number before, 1 in 8. That's the lifetime risk for a woman to develop breast cancer. And yeah, that sounds pretty daunting. It's exactly why we need to have this conversation. But here's the big question. Is that risk just set in stone? Is it a done deal? Well, the answer is a huge, resounding no. There is so much more to the story, which brings us right to our first section. All right, let's dive right in. We're going to start with your genetic blueprint. Basically, the risk factors you can't really change. These kind of set the baseline for everyone. So what are we talking about here? Things like just getting older or being born female, your direct family history, if your mother or sister had it, and then there are those inherited gene mutations you hear about like BRCA1 and BRCA2. But here's what's super important to remember. Even with a strong family history or one of these genes, it is not a guarantee. Think of these as just one piece of a much bigger puzzle. And that leads perfectly to this quote, which I think just nails it. Your genetics may load the gun, but your environment pulls the trigger. This is such a great way to think about it, right? It's all about how our choices, our lifestyle, can actually tell our genes what to do. It's like we have the ability to keep that trigger from ever being pulled. Okay, so let's talk about pulling that trigger, or rather not pulling it. This next part is all about the things that are completely within your power to change, and how you can build up your own defense. Research points to these 4 big pillars. First up, reaching a healthy weight. This is so important because extra fat cells can actually produce more estrogen. Second, get moving. Being physically active helps keep your hormones in check. Third, and this is a big one, limit or even avoid alcohol. Even a little bit can raise your risk. And finally, paying attention to chemical exposures. And we'll talk a bit more about what that means in a sec. And if you're wondering if these things really make a difference, check this out. One huge study found a jaw-dropping 60% decrease in breast cancer risk for women who followed at least 5 healthy lifestyle habits. That's huge. It's not about being perfect, it's about the overall pattern. Stacking these good habits together is what really gives you the power. So when we talked about minimizing chemicals, this is a key one to know. Xenoestrogens. It's a fancy word, but it just means chemicals that act like estrogen in your body. They can really mess with your natural hormone balance. You find them in things like some plastics, think BPA, pesticides, and even parabens in beauty products. But the good news is, simple swaps, like using glass containers for your food or just reading labels on your skincare, can make a real difference. All right, let's keep building on this idea of lifestyle changes and talk about something we all do every day. Eat. Your plate is one of the most powerful tools you have in your arsenal. The science is pretty clear on this. You want to load up on whole, plant-based foods. Things like cruciferous veggies, that's your broccoli and cauliflower, are amazing because they help your body handle estrogen in a healthy way. Berries are just packed with antioxidants, and fatty fish gives you those anti-inflammatory omega-3s. On the flip side, you want to cut back on things like processed meats, tons of added sugar, and fried foods, because those can fuel inflammation, which is something we want to avoid. Okay, let's tackle a big one. What is the deal with soy? Seriously, for years, this has been a massive point of confusion and, frankly, fear for a lot of people. So let's clear the air with what the most current science actually says. Here's the bottom line. After years of bad information, we now have these huge studies showing that whole soy foods, we're talking edamame, tofu, tempeh, are not only safe, but they might even be protective. Yeah, protective. They might even lower the risk of the cancer coming back. The old fear was based on really outdated info. So go ahead and enjoy that tofu. Now, this next point is so important. It's a common mix-up, but really getting this distinction is crucial if you want to feel empowered about your health. Okay, so you see two different goals here. On one side, we have early detection. This is your mammograms, your self-exams, MRIs. The whole point is to find cancer early if it's there, which is absolutely critical for treatment. But it doesn't stop you from getting cancer in the first place. That's the job of prevention, all that stuff we just talked about. Think of it like this. Detection is your smoke alarm. It finds the fire early. Prevention is like fireproofing your house so the fire never even starts. And finally, it's really important to know what happens if a diagnosis does occur, because even then, knowledge is absolutely your most powerful tool for figuring out the path forward. The first thing to know is that breast cancer isn't just one disease. Doctors classify the cancer by looking at what's driving it. So for HR-positive cancers, they're fueled by estrogen, so you use hormone therapy to block that fuel. If it's HER2-positive, it has too much of a growth protein, so they use targeted drugs to block it. And then there's triple-negative, which lacks these receptors, so the approach there is more often chemotherapy or newer immunotherapies. So this is the modern toolkit that doctors have to work with today. And treatment is almost never just one thing. It's usually a combination, a plan put together by a whole team of specialists to attack the cancer from multiple angles, all designed specifically for that cancer type and for you as an individual. So that leaves us with this final big question. As we get better and better at decoding both our genes and our lifestyles, are we getting closer to a future where breast cancer is a largely preventable disease? The science seems to be pointing in that direction, showing us that we have more control than we ever thought. Thank you for being with us until the end of this video. Please be sure to subscribe to the What Does Science Say channel and give us energy with your likes and comments. Share your comments with us and send the video to your loved ones so that others can also use it.